Lower extremity angiogram or intervention. Before your procedure, a nurse will call you with instructions a couple days prior to your procedure. You will need to have blood tests completed 1 week prior to your appointment. Hold only those medications as directed by the nurse. Take all other medications as usual, especially blood pressure medication. Be sure to wear something comfortable. Have a driver bring you to and from the procedure, and you may drink liquids but no solid food after midnight. The day of your procedure, be sure to arrive 1 hour prior to your appointment. A nurse will record your vital signs, such as blood pressure, heart rate, oxygen, and temperature. You will be asked to read and sign the consent for the procedure, and Dr. Iqbal or physician assistant will discuss the procedure and address any questions or concerns. An IV will be inserted into your arm for hydration. The pulses in your feet will be assessed using a handheld Doppler. Your groin will be shaved. This will be the access site during the procedure. A urinary catheter may also be inserted. During the procedure, you will be brought to the procedure room by our staff and placed on the procedure table. Your leg and groin will be cleansed thoroughly with a medical cleanser. A sterile drape will be placed over you. You will be connected to a machine to monitor your heart, blood pressure, and oxygen. Medications will be given to help you relax and reduce pain. An X-ray will be used to help guide a tiny tube called a catheter through your vessels to the blockages. This procedure will take around 1 to 2 hours. After the procedure, you will be asked to stay in bed in the recovery room for at least 2 hours following the procedure. You must lay flat for the first hour. After 1 hour, you may sit up in bed. Blood thinner medications will be given to you to help prevent clotting. A nurse will continue to monitor your vital signs and puncture site. There may be some mild discomfort at the puncture site after the local anesthesia wears off. This discomfort should improve over a few days. Redness, swelling, or bruising may be normal for 3 to 5 days after the procedure. Care at home. No strenuous activity for 3 days. No lifting over 10 pounds. Avoid bending, bouncing, pushing, pulling. Avoid activities such as jogging, vacuuming, laundry, and yard work. It's especially important to rest your leg. No baths, hot tubs, swimming for 3 days. You may shower 48 hours after your procedure. You may climb stairs, but avoid multiple trips up and down. If your puncture site is in the groin, hold pressure over the puncture site whenever you climb stairs, cough, sneeze, or move your bowels to support your groin. You may resume a normal diet. Be sure to drink extra fluids over the next several days to help flush the contrast dye out of your system. Wound care. Remove the dressing from the puncture site after 48 hours. Do not remove it dry. Remove it in the shower to help loosen the adhesive. Wash the area with mild soap and rinse. Apply a Band-Aid for 1 day. Do not scrub, rub, or apply any powders, lotions, creams, or ointments to the area. Complications. If bleeding occurs at the site, lie down and hold firm pressure to the area. Call 911 and go to the nearest emergency room for treatment. You may develop a lump the size of a penny in the groin at the puncture site. This is normal and may be present for up to 4 weeks. If the lump is larger, please call the office. Notify your healthcare provider immediately if your leg becomes cold, numb, tingly, blue, or painful. Call 911 if you are unable to reach your provider. Medications. If you are taking metformin, you should not take it for a full 48 hours after the procedure. If you are taking blood thinners such as Coumadin, Xarelto, Pradaxa, Eliquis, you should continue those as directed.